Hello, everyone. I'm Dr. Lisa Taylor-Swanson. I'm an assistant professor here at the University of Utah in the College of Nursing. And I'm really excited to tell you about some innovative pilot work we've engaged in Guatemala with lay midwives. And the key takeaway is that we were able to train lay midwives in the use of acupressure to have that as a skill that they could utilize when attending births, whether it was time for the baby to be coming, they were at or post dates. So one set of acupoints were to improve labor, to encourage rather labor. And then a second set of acupoints to discourage labor if mom was preterm and we really didn't want to see the baby coming so soon. So a little bit of background. In Guatemala, lay midwives, they're called comadronas. They are trusted birth attendants, especially for rural and indigenous women. They have really limited tools and training for addressing obstetric complications. In this case of looking at preterm and post-term labor, we were again hoping to train lay midwives in a new tool that they could use to help their patients. We used a pre-post design with a single arm, just working with these lay midwives. And it was an exploratory design. This was our first time teaching them acupressure and wanted to see what they thought about it. If it would be feasible and acceptable, those kinds of things. And again, we used two acupressure protocols, one to prevent labor and one to promote it. And we used a focus group setting and educational activities, including storytelling, teachbacks, and practice opportunities. We provided Spanish language reminder cards. They're pictured here in the center of the poster. The blue font is teeny, but it's in Spanish, and that was a way to have this laminated reminder card they could refer to during labor if needed. This, of course, had IRB ethics approval. And we were on site last year in Guatemala. We worked with 11 lay midwives. They ranged in ages from 31 to 7 and with an astounding range of experience between 1 and 52 years. Pre-test, nobody knew anything about acupressure. This was all new information. And post-test, happily, midwives did demonstrate an understanding of the acupoints, both to discourage and to encourage labor. Our participants expressed they were really excited to use this information. They were planning on using it with their patients. And it was very easy for them to understand where to locate the points and to demonstrate their acupressure skills. And not only were they excited to try out these new skills, they asked us to come back next year and to provide additional acupressure training for other obstetric complications. So I want to acknowledge all my authors, but I won't do so by individual name. As you can see, we've got a very big team. But I will note that this work builds on Dr. Kimberly Garcia's longstanding work in Guatemala. She's been going for over 15 years, working with lay midwives all along. So it was really exciting for our team to deliver this new information to her longstanding colleagues in Guatemala. And I'll also note we had students on our team, both at the undergraduate and graduate level here in the College of Nursing, as well as colleagues abroad in Guatemala and domestically in New York State and in Massachusetts. So kudos to our big team for pulling this off. And we're really excited to continue this work and hopefully tell you more about it next year. Thank you very much for your attention.